Hey everyone, it's Dr. Kevin Wafer with Core Chiropractic in the Energy Corridor, and it's time for this week's Ask the Doc segment. And this is one of my favorite questions I hear from patients. And the question is, I can crack my own neck or back, why do I need to see a chiropractor? And this is a question that we hear really commonly from patients. And to kind of answer the question, we'll answer it in two parts. The first part we'll talk about is what you're doing when you're cracking your neck. So if you know anybody who cracks their neck or cracks their back, how do they do it? They're really just kind of putting their hand on their chin, they're twisting as much as they can, hoping they can get anything to pop in the neck. The back is kind of the same way. They're just twisting, maybe pulling themselves across a chair, just hoping they can get some pops. And when they feel that and when they hear those pops, they do feel better. So why is that? Because what happens is when the popping noise occurs, your body releases endorphins, okay? So if you know anything about hormones, endorphins are the hormones that make your body feel good, okay? The only problem is they only last in the bloodstream for 30, 45 minutes at the most. So if you know anybody who cracks their own neck or back, how often are they doing it? They're doing it on a constant, regular basis. So they're not doing anything to really fix their spine. They're just using endorphins to mask their pain to help get them to feel better that way. So that's why somebody feels like they always have to constantly crack their neck, because it's really just an endorphin high. Now, so that's how you crack your neck. What's the difference between cracking your neck and really an adjustment? So when we adjust the spine, this would be us looking at your spine from behind. So these would be the bones in the neck and the upper back through here. So ideally, these would all line up in a straight line. But as chiropractors, what we find is vertebrae or the bones of the spine shift in one direction or the other. When that happens, you can put pressure onto a nerve. That's where the pain comes from. So as chiropractors, what we do is we find these misalignments and then we use our hands to start to push them back into position. So we free up the pressure off the nerve, so we relieve pain that way. Now, as a secondary effect of the adjustment, there are cracks and pops. So you also get that endorphin rush, but since we're freeing up that nerve pressure and you're also relaxing those muscles, that's why you get a lot more long-lasting relief from an adjustment from just cracking your own neck or back. And here at Core Chiropractic, we use x-rays and with measurements, that way we can find exactly where these misalignments are, how the bone has become misaligned, and what we need to do to get them corrected. So that's the difference between just cracking your neck and also an adjustment. So as a cracking, we're not relying on the endorphins. For the adjustment, we're really realigning the spine. And as chiropractors, we can't even adjust our own spine. We have to have our fellow associates who we work with get us that we get adjusted on a regular basis to help us feeling good. As much as I would love to say I can go home and adjust my own neck or back, it's just not that simple. We need chiropractors as well. So I hope this has answered your question on the difference between cracking your neck and getting adjustment. An adjustment is far from just a crack. It's just a way we can, what we're really trying to do is realign the spine, get your spine functioning better, and relieve that nerve pressure. So I hope everybody has a great rest of the day, and I'll see you all next week.